Alicia.
Hi, Renee. How are you?
I am doing great. It's so good to see you again, and so good to be here with you to present this information that a lot of Medicare beneficiaries are not aware of.
That is correct.
So I want to say hello again to everyone. Welcome to Secure65 Health Plans. I'm Monet Swan, CEO of Bivix Wealth and Insurance Solutions. Today, we're going to do a deep dive into Medicare Part C, also known as Medicare Advantage, and how the recent changes could affect you. Alicia?
That's right, Monet. Hi, everyone. I'm Alicia Alquino, and I'm the CEO of Bivix Wealth and Insurance Solutions. Thank you for being here today. It is crucial for everyone to understand both opportunities and challenges with Medicare Part C, also known as Medicare Advantage. From doctors and hospitals, changing the network, affiliations to pharmacies, adjusting their plan participation, staying informed is key. And remember to like, share, and subscribe to keep up with all things Medicare related.
All things Medicare related. That's what we do. So let's talk about Medicare Advantage plans, also known as Part C. These plans can, present several challenges for beneficiaries due to changes in network and service areas. These changes can impact access to healthcare providers and the availability of coverage. So here are some examples of common issues faced by beneficiaries enrolled in Medicare Advantage plans. Alicia, I want to start with the doctors first. Is that okay?
Absolutely. Go for it.
Okay, so you guys, if you didn't hear about this, doctors are leaving the network. And this is becoming commonplace because Medicare Advantage plans can change their doctors and specialists, and they may decide, the doctors and specialists, not to renew their contracts with the insurance carrier, leaving the network, unexpectedly, and leaving you without coverage. This can disrupt ongoing care, especially for patients with chronic conditions who have built long-standing relationships with their doctors. For instance, a beneficiary in Florida might find their cardiologist, who has been managing their heart conditions for years, is no longer in network, forcing them to either find a new doctor within network or pay higher out-of-network rates.
And unfortunately, this is also impacting carriers leaving zip codes. We know for a fact, and made the news, that thousands and thousands of Kansas residents ended up without any insurance carriers. So, insurance carriers may decide to withdraw their Medicare Advantage plans for certain geographical areas or zip codes. This decision can be influenced by various factors, including economic viability, changes in local healthcare regulations, or shifts in the healthcare provider landscape. For example, in rural areas like some parts of Wyoming, recipients may find their plan options are suddenly limited if a carrier pulls out, potentially leaving them with fewer choices and higher costs.
And Lizzie, did I mention all of this is leading beneficiaries naked, leaving them naked without coverage? That's just, to me, unbelievable. Because of this, some beneficiaries will lose coverage. And you guys can find out that without the coverage, you're in a Medicare Advantage plan that can no longer provide you with the safety that you need. When a Medicare Advantage plan is discontinued, you can't enroll in that plan anymore during this enrollment period. This situation might occur when insurance companies reassess their plan offerings based on profitability or patient demographics. A beneficiary in a suburban area of Ohio, for instance, might discover that their plan is no longer available. And if not proactive about finding a new plan, what's the result? Being left without coverage.
My goodness. And what can be as bad as losing coverage? You say, losing access to the drugs that keep you alive, healthy, or without pain. Pharmacy network changes. Medicare Advantage plans often have specific networks. Changes in this network can mean that the recipient's local pharmacy is no longer preferred, which can lead to higher copayments for medications. We've all seen that before. A Medicare recipient in California may find their regular pharmacy, which was once part of a preferred network, offer lower copays. Is now a standard, increasing their medication costs unexpectedly. Also, annual changes during open enrollment. Each year during the annual enrollment period, which is right now, October 15th through December 7th, Medicare Advantage plans can make changes to their network, premium, co-pays, and the list of covered drugs, also known as formularies. Recipients need to review their plans detailed annually to avoid surprises. For instance, a Medicare recipient in New York may not realize their plan has increased the deductible or copay for specialist visits until they receive care in the new plan year.
And you guys, these examples highlight the importance for Medicare Advantage enrollees to stay informed about their plans, terms, and networks, particularly during AEP. It's also crucial for beneficiaries to understand their rights and options, such as special enrollment periods, also known as SEPs, that may allow changes outside of the usual enrollment times if they experience network or coverage disruptions. That's really important. Now, let's talk about two great amendments to Medicare Advantage this year. We've talked enough about the bad stuff, right? The Inflation Reduction Act and the Medicare Prescription Payment Plan. Yay! The Inflation Reduction Act and the new drug plan changes can benefit you by spreading out your drug costs throughout the year. No more budget surprises in January. The Centers for Medicare and Medicaid, CMS, has introduced the Medicare Prescription Payment Plan, effective when? 2025.
Awesome. First thing first, the Inflation Reduction Act. The Inflation Reduction Act of 2022 introduced several significant reforms to Medicare, particularly impacting Medicare Part D, the prescription drug plan. These changes aim to reduce out-of-pocket costs for recipients and control the overall price inflation of drugs. Here's a breakdown on how it works and the specifics of the cap on drug cost. Key features of the Inflation Reduction Act regarding Medicare Part D. Negotiation of drug prices. For the first time, Medicare is allowed to negotiate prices directly with drug manufacturers for certain high-cost drugs covered under Part B and Part D. The negotiation process is set to begin in 2023, with the negotiated prices taking effect in 2026. Now, the annual out-of-pocket cap is starting in 2025, which is even closer to us. The Inflation Reduction Act imposes a significant new cap on out-of-pocket spending for Medicare Part D recipients. The cap is set at $2,000 per year. This means that once a Medicare recipient spends $2,000 out of pocket in a calendar year, they won't have to pay any more for their prescription drugs for the rest of that year. Understand? Part D coverage. Can you imagine that? That is amazing.
I mean, we were just talking to a client the other day, and one of the drugs was $500 a month.
Wow.
So yeah, we are thrilled about that. So you guys, you might be asking, well, what was replaced? Well, prior to the Inflation Reduction Act, there was no cap on the maximum out-of-pocket drug spending under Medicare Part D. Beneficiaries would pay a percentage of drug costs in the catastrophic phase of coverage after surpassing a threshold set by Medicare. So in 2022, this was after spending, are you ready? $7,050 out of pocket. That's not small chump change. So under the new law, this structure is modified by the introduction of the $2,000 cap, significantly lowering the potential maximum financial burden on beneficiaries. So now let's talk about the Medicare Prescription Payment Plan, effective 2025. Well, this is also part 2 of the plan, which allows Medicare Part D beneficiaries to spread their out-of-pocket prescription drug costs over the calendar year instead of paying the full amount at the pharmacy counter. Yikes. This change is particularly significant because it helps beneficiaries manage their budget by avoiding high upfront costs typically experienced at the beginning of the coverage year, especially for those who reach for the coverage gap, or also known as the donut hole. So starting in 2025, Medicare beneficiaries will have the option to pay their out-of-pocket drug costs in more manageable monthly installments rather than upfront, making expensive medications more accessible financially throughout the year.
First up, let's talk network changes, Monet.
Okay.
Every year, healthcare providers review their contracts with Medicare Advantage plans. Some decide to drop out, while others may change their terms. This means your current doctor or hospital may no longer be in network, which can affect where you can receive care without paying extra money.
Hey, and it's not just about where you can go, it's also about how much you'll pay. If your favorite pharmacy moves from a preferred to a standard, well, your medication costs could jump significantly. That's why it's important to review your plan details every year during the enrollment period. So let us do the work for you. I was greatly saddened to hear that one of our clients stated that before she called us, an agent called her from a carrier and didn't offer her anything but a Medicare Advantage plan. She thought that was all there is. I asked her if she knew of any changes and if she would like me to go over it, and she was told by the agent that she didn't think any of the changes would affect her. So you guys, please talk to a Medicare agent that explains what's really going on in Medicare Advantage plans, because they're not all bad people out there, but you need to do your homework and look for star ratings when deciding. Work with an ethical, supportive agent that will explain the plans with you. Go over your doctors, your prescriptions, and your finances to make sure you are on the right plan and that plan is right for you.
Thank you, Monet. Moving on to some more good news. We are Vivek's Wealth and Insurance Solutions. We're in 45 states, and we offer assistance with Medicare before, during, and after you have signed up with Social Security, life insurance, final expenses, dental, hearing, vision, and the list goes on, as well as copay. Listen to this one. Copay protection plans to pay for all your out-of-pocket expenses from your Medicare Advantage plans. Yes, you heard me right. Remember, you choose the pay maybe later plan with a cap anywhere from $5,000 to $8,000 in network and $8,000 to $13,000 out of network. So if you want to see how you can reduce those costs for as little as $25 to $30 a month, call us today and let us help you reduce those costs.
Hey, and don't forget, our team at Secure 65 Health Plans can help you understand these changes and how they affect your coverage. So just give us a call at 833-300-4968, or you can always email us at info@mybivics.com. That's info, I-N-F-O, at bivx.com. We're here to make Medicare simple and secure for you.
Now let's talk about how to protect your cash, your savings, your assets, and your financial future. Our co-payment protection plan is designed to cover those unexpected high out-of-pocket expenses that can arise from hospitalization, cancer treatment, strokes, heart attacks, and accidents.
Exactly, Alicia. Our plan steps in to cover these costs so you don't have to worry about financial surprises when you're focusing on getting better. These plans are designed to protect you from high medical costs that often accompany unexpected health issues. So let's dive into the details and real life stories that show just how beneficial these plans can be. Let's start with our hospital indemnity plan, available for you just as little as $23. I think that's even less than going to McDonald's, isn't it, Alicia? I think it's even less.
I believe so.
A month, not a day, not a week, a month. Imagine having a plan that pays you for each day you're in the hospital, covering ambulance services or even home health care that pays you for having a prescription and even accidents. You can get up to $900 for filling in your prescriptions, even if you don't pay for it. I think that's crazy, but they want to make sure you do what the doctor orders. This basically pays for the policy and gives you extra money for other things. So listen, there are several levels and several carriers that we work with. So call us today so that we can guide you to the best insurance company and plan for you. Hey, Net, can you play the recording from one of our clients?
Thanks to my hospital indemnity plan, after my unexpected hospital stay, I received checks that helped cover everything from my hospital bills to my day-to-day expenses. It was a financial lifesaver.
Moving on to our accident and accidental death policy. This is essential for anyone who may find themselves in an emergency room due to an accident. This policy provides benefit for X-ray, surgeries, fractures, and more. You can also opt for a lump sum payment up to $350,000, or choose our critical illness policy, which also pays up to $350,000 for covered incident.
Wow. And for those dealing with specific health conditions, our specialized policies are invaluable. For example, our heart and stroke policy can provide up to $165,000. That's a pretty good deal. And for our cancer survivors, depending on how long you've been in remission, our cancer policy helps you cover everything from chemotherapy to alternative care and travel expenses.
For example, a minor fall at home led to a major payout. From my accident policy, I received over $20,000, which helped immensely during my recovery. This is a testimonial from Mrs. T in Los Angeles, California. And for intensive care needs, or ICU coverage can offer up to $1,600 a day. These plans ensure that if you face a high deductible bill, you're not only able to pay it, but also manage other financial responsibilities that accumulates.
Hey, and you know what, Alicia? There's some people that don't make $1,600 a week. So for you to know that you can still get the coverage that you need financially, as well as have some extra money, it's not such a bad thing. It'll help you heal faster to know that you don't have to worry about finances. So lastly, while we cannot discuss life insurance or retirement strategies during our Medicare calls, it's important to know that we're here to help protect and grow your money as well. So if you're worried about market volatility, let us show you how to secure your investments with strategies that offer growth and security. It's important to realize that right now we're getting ready to go for a course correction. Not exactly sure what day the market's going to course correct, but you need to call us so we can tell you how to get your money out and put it into something a little bit more safe. So how do you do that? Well, you call us at 833-300-4968 or visit us online at info@mybivix.com. And remember, no senior should ever enroll in Medicare with a stranger. That's our motto, because that gives you peace of mind.
And don't forget, liking, sharing, and subscribing helps us bring more useful content to you. Stay healthy, stay golden, and let's make sure you get the biggest bang for your money with Secure65 Health Plans. And for those in need of dental care, we got something special. Our standalone dental plans cover up to $10,000 with no waiting periods for those who need immediate help. It is all about getting you the care you need when you need it. We have what you need at an affordable price. So call us today if you need one or even two dental policies to cover all of your dental needs.
And don't you worry about a thing, because by coordinating this coverage with your Medicare plan, you truly get the best of both worlds. Comprehensive care without the hassle. Remember, no senior should enroll in Medicare with a stranger. Get to know us, because at Secure65 Health Plans, we're all about safety, love, and community.
Before we close, let's reflect on something important. Seniors, you are a beautiful community of diverse, vibrant members of society who deserve respect and thoughtful care, and we're here for you. Always remember, no one should ever enroll in Medicare with a stranger. Call us today for free spoke experience that treats you like you should be treated. Don't sign up with someone just because they called. Check them out. Call them back. If you can't call them back, then that means you can't call them when you need them either. Call us today to set up an appointment at 833-300-4968.
Ooh, I love that, Alicia. And speaking of community, let's not forget about the Collaborative Expansion Foundation. Together with Bivix Wealth and Insurance Solutions, we're working to ensure every senior is supported and valued. Net, show the video. At Collaborative Expansion Foundation, we empower seniors by addressing their critical needs and fostering trusted relationships. We combat loneliness, financial insecurity, and access issues through education, community engagement, and support. Guided by our motto, no senior should enroll in Medicare with a stranger, we strive to ensure all seniors receive the care they deserve. Together, we create a caring, inclusive community. Now, if you want to be in a community where you are loved, appreciated, and treated like family, call us today at 833-300-4968. No one knows what tomorrow will bring, but I can assure you we will be there to help you every step of the way. We are not a call center, and we are not captive agents, handcuffed to one carrier with limited options. We are Medicare brokers, senior advocates, and financial professionals. We can handle everything for you.
You will always get the truth, support, and information you need to make an informed decision without pushiness or aggressive behavior, because we do this for you. Our goal is to provide the best service. That is our mission. It has never been or never will be about the commission. We are seniors too. We love you guys. Watch us every Thursday at 11 o'clock Pacific Standard Time, 1 o'clock Central Standard Time, and 2 o'clock Eastern on this same YouTube channel or on Facebook. We're here for you. Thank you for joining us today. Don't forget to like, share, and subscribe for more insights.
And don't forget, we are free. You don't pay us for anything. This is all the things that we just give to you. Why? Because we love you. So thank you again for joining us today. Stay happy, stay healthy, and stay golden. I'm Monet Swan.
And I'm Alicia Alcano. See you next week.
Bye.
Bye.
Come be a part of our community. Secure65 Health Plans. We are the vision. We are disruptors. We are changing the way seniors do business. Become one of us. We are your community, and we are here for you. No senior should ever enroll in Medicare with a stranger. AEP annual enrollment period is ongoing, October 15th through December 7th. Call us now at 213-394-8885 or 833-300-4968. Email us at info@mybivix.com. Secure65 Health Plans, where seniors thrive.